Hello and welcome to Medical Dialogues. I am Dr. Bhumika Makhuri. Let's look at today's top medical news. Waist to height ratio versus BMI, which is better predictor of heart health. Waist to height ratio is a more accurate predictor of heart failure than body mass index, BMI, according to new research presented at Heart Failure 2025, a scientific congress of the European Society of Cardiology. The study found that individuals with a higher waist-to-height ratio had a significantly increased risk of developing heart failure, suggesting that waist-to-height ratio may be a better tool than BMI for identifying patients who could benefit from obesity-related interventions. The research analyzed data from 1,792 participants in the Malmo Preventive Project. Participants were aged 45 to 73 at the start of the study and included a balanced distribution of individuals with normal blood glucose, impaired fasting glucose, and diabetes. Over a median follow-up period of 12.6 years, 132 participants developed heart failure. The study found that a higher waist-to-height ratio was associated with a significantly greater risk of heart failure. For each standard deviation increase in waist-to-height ratio, the hazard ratio for incident heart failure was 1.34, even after adjusting for potential confounders. When categorized into quartiles, individuals in the highest waist-to-height ratio group had nearly 3 times the risk of heart failure compared to those in the lower 3 quartiles. 1 in 10 asthma cases linked to harmful urban environments study. A large study has revealed that the combination of air pollution, dense urban development, and limited access to green spaces significantly increases the risk of asthma in both children and adults. Published in the Lancet Regional Health, Europe, the study concludes that improving urban environmental conditions could potentially prevent approximately 1 in 10 asthma cases. The research, led by Karolinska Institutet in Sweden as part of a major EU collaboration, analyzed data from nearly 350,000 individuals across 14 population cohorts in 7 European countries. By linking participants' residential addresses to environmental data, the researchers assessed multiple urban exposures, including levels of air pollution, outdoor temperature, population density, and the availability of green and blue spaces using satellite imagery. What sets this study apart is its comprehensive approach to environmental risk. Over the course of the study, approximately 7,500 individuals developed asthma. The researchers found that 11.6% of these cases could be attributed to the combined effect of harmful environmental conditions, underscoring the significant role of urban design in public health outcomes. Can mindfulness retrain the brain to reduce anxiety? Mindfulness can significantly reduce anxiety symptoms, and different mindfulness practices may be more effective for specific types of anxiety, according to a new study published in Neuroscience and Biobehavioral Reviews. The research concludes that aligning mindfulness techniques with individual anxiety patterns could lead to more targeted and effective treatment strategies. The framework of the study moves away from the traditional one-size-fits-all model, instead proposing a tailored approach to using mindfulness for anxiety, which spans from mild worry to more severe clinical conditions. At the core of this new model is the role of cognitive control, the mental ability to regulate thoughts and actions toward achieving goals. Resh Gupta, study's lead author and a postdoctoral research associate with the Mindfulness Science and Practice Cluster at Washington University in St. Louis, explains that mindfulness enhances cognitive control, while anxiety undermines it by flooding the brain's working memory with worry. Neuroimaging studies support this idea, showing that mindfulness meditation strengthens brain areas associated with cognitive control.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.